Greetings! How are you feeling? Today, I want to discuss an important topic, colorectal cancer, also referred to as intestinal cancer. It's crucial to understand this type of tumor because it ranks as the third most common form of cancer and is the second leading cause of cancer-related deaths. Shockingly, approximately 20% of cancer-related deaths can be attributed to colorectal cancer. So, it's essential to pay attention. To ensure a comprehensive coverage, this video will be divided into two parts. First, we'll explore the signs and symptoms of colorectal cancer, those visible or perceptible indications that something might be amiss. These are the warning signs. Then, in the second part, which I consider the most critical, we'll delve into prevention methods. We'll discuss habits you should adopt and foods you should consume to lower your risk of developing this disease. We'll also address polyps and what actions you can take to prevent their formation. Additionally, we'll explore why colorectal cancer is becoming more prevalent among individuals under 50 years old. Before we get started, I'd appreciate it if you could like this video. By doing so, you help increase its reach on YouTube, allowing it to reach those who lack access to doctors or hospitals. Moreover, please share this video with your friends and family, as your assistance can potentially save lives. So, without hesitation, spread the word. Lastly, I'm curious to know if you're acquainted with someone who has experienced colorectal cancer. Feel free to share your location within the United States or anywhere else in the world. Write it down in the comments section below. Let's get started. The seventh symptom to be aware of is a change in bowel habits. It's crucial for you to pay attention to your bowel movements. Everyone has different patterns. Some may go to the bathroom shortly after breakfast, while others may have bowel movements 2 or 3 times a day. There are also those who have them 2 or 3 times a week. How about your bowel transit? If you notice any alterations in your bowel movements, it's important to take notice. Changes in bowel habits are quite common as we age and, on their own, they might not raise immediate concerns. However, if these changes persist or worsen, it's advisable to consult a doctor. Around 65% of individuals with colorectal cancer experience changes in their bowel movements. These changes can vary from person to person and depend on factors such as the tumor's location, size, and stage. You might observe changes in stool consistency and color, an increase or decrease in the frequency of bowel movements, or the emergence of diarrhea unrelated to a viral infection that lasts longer than a few days. Constipation followed by an episode of diarrhea can also be indicative of a change. Sixth on the list is the symptom of blood in the stool. It's crucial for you to be attentive to the appearance of your stools. Understanding the types of bleeding to watch out for is important. The large intestine consists of various sections: the ascending colon, transverse colon, descending colon, sigmoid colon, followed by the rectum and anus. The right side of the colon has a unique characteristic: it is larger, and the stools tend to be more liquid due to the colon's role in water absorption. If a tumor is present on the right side, specifically in the ascending colon, there may not be noticeable symptoms of obstruction. Instead, the tumor might cause more bleeding, leading to anemia. You may also observe a change in stool color, turning black like tar, which is known as melena. Melena often has a distinct foul odor. On the other hand, the left side, encompassing the descending colon and sigmoid colon, is narrower, and the stools are generally more formed. Bleeding from this side may appear as brighter blood that drips into the toilet after bowel movements or when you wipe with toilet paper. Of course, it's important to consider other factors that can cause these symptoms. Conditions such as hemorrhoids, fissures, or even consuming beets, which can temporarily change stool color to red, may also be contributing factors. However, it is crucial to ensure that the bleeding is not indicative of a more serious condition. One should not simply assume that it's solely due to hemorrhoids. Bleeding can occur in varying degrees, ranging from small amounts of blood in the stool to severe hemorrhages. Why does colon cancer lead to blood in the stool? It could be due to ulceration of the tumor, causing a small blood vessel supplying the tumor to bleed. It could also result from a wound in the intestine caused by the tumor or excessive strain that increases pressure on the intestinal wall and leads to bleeding. The fifth symptom to be aware of is abdominal pain. If you've never experienced abdominal pain before and suddenly find yourself enduring intense cramps that persist and fluctuate, or if you experience pain during bowel movements, particularly when the tumor affects the rectal area, it's crucial to seek medical assistance. It's worth considering if excess gas could be the cause. Have you recently made changes to your diet and consumed a high amount of fiber? This could potentially explain the discomfort. The fourth symptom to be mindful of is fatigue and tiredness. It's important to differentiate this fatigue from the usual tiredness that follows a poor night's sleep. This fatigue is more prolonged, lasting for 2 weeks or even a month. In the case of intestinal cancer, this fatigue can be attributed to hidden anemia. As mentioned earlier, the tumor may be causing slow bleeding, leading to anemia. Even if you have a healthy diet, you might still experience iron deficiency anemia. Therefore, it's crucial to investigate this symptom, as intestinal cancer is one of the primary causes of unexplained anemia. Some may say, "No, I don't have anemia." However, cancer cells consume a significant amount of energy as they rapidly divide. This can result in exhaustion. Moreover, cancer cells may be depleting essential nutrients from your body, contributing to chronic fatigue and tiredness. Therefore, it's important not to dismiss this symptom and seek medical attention if you experience persistent fatigue and tiredness. The third symptom to be mindful of is abdominal bloating. This swelling or distension of the abdomen can indeed be a common indicator of intestinal cancer. There are several reasons why this occurs. It could be due to the tumor partially or completely obstructing the intestine, leading to the accumulation of gas and stool. Moreover, the tumor may hinder the normal passage of food and liquids, contributing to abdominal bloating. The excess gas can also result in abdominal pain, such as cramps or persistent discomfort. Therefore, it's important not to disregard these symptoms. While there are various factors that can cause bloating and abdominal pain, it's always advisable to seek medical attention if you experience unusual or frequent abdominal bloating and pain. The second symptom to be aware of is unexplained weight loss. It's important to note that if you are intentionally dieting and have lost weight, that can be expected. However, I'm referring to weight loss that occurs without any clear explanation. If you find yourself losing weight without making any changes to your diet, without feeling depressed, and without exercising more than before, it's crucial to take note. Weight loss associated with intestinal cancer can stem from various reasons. Firstly, the tumor can interfere with the body's ability to absorb nutrients and calories, essentially behaving like a parasite that consumes resources for its own growth. In addition, the tumor might produce certain cytokines such as TNF-alpha, interleukins 1 and 6, which can suppress appetite and lead to weight loss. Moreover, the tumor can increase the body's energy expenditure, resulting in the loss of not only fat but also muscle mass. Furthermore, if the tumor obstructs the intestinal passage, it can cause symptoms like nausea and vomiting, which can contribute to weight loss. The first symptom to be aware of is a sensation of incomplete bowel emptying, also known as tenesmus. It refers to the feeling that something is still stuck in the intestines even after having a bowel movement, leading to a need to return to the toilet. Tenesmus is an unpleasant sensation of incomplete evacuation, even when the bowel movement is considered complete and there is no remaining stool in the intestines. This sensation is a common symptom of intestinal cancer. It occurs because the tumor can partially or fully obstruct the intestine, creating the perception of fecal matter that is actually the tumor itself. In such cases, changes in the shape of the stool may accompany this sensation. The stool can become thin and ribbon-like as it passes through the tumor, resulting in an unusual appearance resembling a ribbon. However, it's important to note that many individuals with colon cancer do not experience noticeable symptoms in the early stages of the disease. While the absence of symptoms is a positive sign, it's essential to be aware of the risk factors and consider undergoing screening for intestinal cancer, especially to check for polyps. So, what exactly are intestinal polyps? They are abnormal growths that develop along the mucous membrane lining the inner surface of the colon. These polyps can form if certain mucosal cells undergo mutations. Most polyps do not become cancerous, but over time, some of them may develop into cancer. Typically, it takes around 10 years for a polyp to progress into cancer if it remains undetected and not removed. Intestinal cancer, like many other diseases, is influenced by various risk factors that contribute to its development. Here are some of the key risk factors. Age. The risk of intestinal cancer significantly increases with age. As we grow older, our immune defenses may weaken, making it more likely for dormant polyps to become cancerous. Regular screening becomes especially important as we age. Inflammatory bowel diseases, conditions such as Crohn's disease or ulcerative colitis, which involve chronic inflammation in the intestines, can raise the risk of developing intestinal cancer. Individuals with ulcerative colitis, in particular, have a higher likelihood of developing colorectal cancer. Genetic syndromes. Certain genetic syndromes can predispose individuals to intestinal cancer. For example, Lynch syndrome is associated with a higher risk of developing this type of cancer. Familial adenomatous polyposis is another genetic syndrome characterized by the formation of multiple polyps, which can also increase the risk of intestinal cancer. Family history. If you have a close relative, such as a parent, sibling, or close relative, who has had intestinal cancer, it raises your own risk. Family history serves as an important factor in assessing individual risk and may require more vigilant monitoring and screening. Height. Interestingly, taller individuals have been found to have an increased risk of developing intestinal cancer. The underlying reasons for this association are still being studied. It's important to note that some of these risk factors, such as age, genetic syndromes, and family history, are beyond an individual's control. However, being aware of these factors can help in understanding personal risk and taking appropriate measures, such as regular screenings and adopting a healthy lifestyle, to mitigate the chances of developing intestinal cancer. There are several risk factors for intestinal cancer that can be modified by making changes in your lifestyle and habits. Here are some factors that depend on you. Cigarette smoking. Smoking is not only linked to lung cancer but also increases the risk of various other cancers, including stomach, intestinal, oral, and bladder cancer. Quitting smoking can significantly reduce your risk. Alcohol consumption. Excessive alcohol consumption is associated with an increased risk of intestinal cancer. Limiting or avoiding alcohol intake can help lower your risk. Sedentary lifestyle. Leading a sedentary lifestyle without regular physical activity can contribute to an increased risk of intestinal cancer. Engaging in regular exercise and staying physically active can help reduce this risk. Obesity. Being overweight or obese is a known risk factor for several types of cancer, including intestinal cancer. Maintaining a healthy weight through a balanced diet and regular exercise can lower your risk. Low-fiber diet. A diet low in fiber, especially one lacking in fruits, vegetables, and high-quality unprocessed foods, can increase the risk of intestinal cancer. Incorporating fiber-rich foods into your diet, such as whole grains, fruits, and vegetables, can be beneficial for reducing this risk. High consumption of processed meats. Consuming large amounts of processed meats like salami, ham, bacon, sausage, and similar products can contribute to an increased risk of intestinal cancer. Limiting your intake of processed meats and opting for healthier protein sources can help lower your risk. Excessive consumption of red meat and saturated fats. Consuming high amounts of red meat and saturated fats, found in foods like beef, pork, lamb, and fatty dairy products, has been associated with an increased risk of intestinal cancer. Moderation and opting for leaner protein sources and healthier fats can be beneficial. The significant increase in colorectal cancer among younger individuals can be attributed to several factors. One primary factor is improper eating habits, such as consuming a lot of processed foods and a lack of whole, nutritious foods in the diet. Additionally, a sedentary lifestyle has become increasingly common, leading to a rise in overweight and obesity rates, which are associated with an increased risk of colorectal cancer. Another contributing factor to the rise in colorectal cancer cases among younger individuals is the initiation of screening at an earlier age and the improved effectiveness of screening methods. By detecting colorectal cancer at an earlier stage, it allows for timely treatment and better outcomes. To protect yourself against colorectal cancer, here are 7 tips. Stay hydrated and drink plenty of fluids, particularly water, as it helps improve intestinal function and prevents constipation. Consume a diet rich in fruits and vegetables that provide fiber and antioxidants, which aid in the movement of feces through the intestines and promote a healthy intestinal flora. Reduce the consumption of red and processed meats, which are linked to an increased risk of colorectal cancer. Include spices and foods with natural anti-inflammatory properties, such as turmeric and cinnamon, in your diet. Consider including dairy products in your diet, as recent evidence suggests they may have protective effects against colorectal cancer. However, if you have lactose intolerance or milk protein allergy, it's best to avoid them. Engage in regular physical activities and avoid a sedentary lifestyle, as exercise helps regulate hormones, reduce inflammation, maintain a healthy weight, and decrease stress levels. Avoid excessive alcohol consumption and refrain from smoking, as both are associated with an increased risk of colorectal cancer. Undergo regular checkups and consider screening tests. At the very least, perform a fecal occult blood test to detect hidden blood in the stool. For individuals with intermediate risk, especially those over 45 years old, a colonoscopy is highly recommended for its ability to detect and remove polyps before they become cancerous. During a colonoscopy, you will need to undergo bowel preparation to ensure the colon is clean. The procedure itself involves the insertion of a thin, illuminated tube with a camera through the anus to examine the rectum and colon. Polyps can be identified and removed during the procedure, reducing the risk of cancer development. Colonoscopy typically takes 30 to 60 minutes to complete. I want to highlight the importance of colonoscopy as a crucial examination that can detect polyps before they develop into cancer. Take a moment to explore this intriguing graph showcasing countries with high rates of colorectal cancer that have successfully reduced their numbers through widespread screening exams, ultimately saving numerous lives. This video serves as an essential tool to raise awareness rather than induce fear. It is crucial for healthcare systems, both public and private, to prioritize and expand access to screening colonoscopies. This shouldn't be limited to individuals experiencing symptoms but should be available to asymptomatic individuals as well, who seek to lead long and healthy lives. Access to screening colonoscopies should not be dependent solely on private insurance or financial means. It is essential for healthcare managers to consider the importance of providing this preventive measure, as removing polyps before they become cancerous can prevent unnecessary suffering and the need for extensive treatments like chemotherapy, radiation therapy, immunotherapy, and more. Early detection significantly improves the chances of successful treatment and complete recovery from colon cancer. In fact, when colon cancer is diagnosed at an early stage, it boasts an impressive 90% cure rate. The cost-benefit ratio of a colonoscopy is remarkably favorable. This is precisely why countries with well-analyzed healthcare systems are reducing the recommended age for the first colonoscopy. In the long run, both the state and health insurance plans will spend considerably less by investing in early detection and prevention. Remember, early diagnosis of colon cancer increases the likelihood of successful treatment, complete recovery, and ultimately a cure. So, don't wait, prioritize your intestinal health and strive to maintain a healthy body. Did you find the video informative? Be sure to share it widely, enabling more individuals to benefit from this valuable knowledge and take proactive steps towards safeguarding their health. Don't forget to subscribe for more updates and informative content. Stay tuned for our next video. Thank you so much.